Hello friends, welcome to Master Nurse. This video is about the Jipmer Norcet Aims series, part 2, exclusively for cardiovascular system. Question 1. First branch of human aorta is dash. A. Left subclavian artery. B. Brachiocephalic artery. C. Coronary artery. And D. Left common carotid artery. The answer C. Coronary artery. The coronary artery will be the first branch to rise immediately after the aorta exits from the heart. And if you see point A, left subclavian artery, it will arise from the aortic arch. And the left common carotid artery will also arise from the aortic arch. Brachiocephalic artery will be a branch of arising from the aortic arch too. Question 2. The hepatic portal system originates from A. Kidney, B. Diaphragm, C. Liver, 4. Different parts of the alimentary canal. The answer D. Different parts of the alimentary canal. So the hepatic portal system is the venous system that collects deoxygenated blood from GI tract, spleen and few organs from the abdominal cavity. So this hepatic portal system consists of three major veins. Number 1, gastric vein. Number 2, pancreaticomesenteric vein. Number 3, lycomesenteric veins. So these three veins from different parts of the alimentary canal combine to form the venous return, that is called the hepatic portal system. Extracellular fluids are rich in the following, except potassium, bicarbonates, C. Sodium and D. Calcium. The correct answer is A. Potassium. So for this you need to know which are the major cations and which are the major anions present in the body fluids. So the major cations are sodium, potassium, magnesium and calcium. The major anions are chlorine, bicarbs, phosphates. And if you see the intracellular fluid, in intracellular fluid, the abundant cation is potassium and the abundant anion is phosphates. In extracellular fluid, the abundant cation is sodium and the abundant anion is chlorides. Question 4. Immunoglobulin which crosses placenta is dash. A. IgG, B. IgD, C. IgM and D. IgE. The right answer A. IgG. So IgG is a very important immunoglobulin that provides protection for the fetus because it is the only immunoglobulin that can pass through the fetus. There are some subtypes or isotypes of IgG. They are IgG 1, 2, 3 and 4. This IgG is also responsible for opsonization, which is an important phenomena in phagocytosis. It increases the destruction of antigens that are present. The next one is IgG. It is found in the beta cells. IgM is the first antibody that is to be produced in response to any antigen, and IgE is responsible for defense again. Question 5. For blood clotting, fibrinogen is changed to fibrin with the help of dash. A. Thrombin, B. Platelets, C. Vitamin K, D. Antithrombin. The right answer A. Thrombin. So if we see the blood clotting mechanism, it is important to note the role of thrombin because thrombin is responsible for activating blood clotting factors which are 5, 7, 8, 11 and 13. With the help of this, fibrinogen is converted to fibrin and it promotes clotting. Question 6. The uterine artery is a branch of dash. A. Common iliac artery, B. External iliac artery, C. Internal iliac artery, D. Descending aorta. The right answer is internal iliac artery. So the abdominal aorta divides into common iliac artery and that further divides into internal and external iliac arteries. So this happens at the level of 4th lumbar vertebra. Remember, 4th lumbar vertebra. Abdominal aorta divides into common iliac artery at the level of 4th lumbar vertebra. So this internal iliac artery is responsible for supplying blood to pelvic organs, gluteal muscles and perineum. Which of the following is the correct pathway for the propagation of cardiac impulse? Which means, what is the right route of conduction of cardiac impulse is the question. A. AV node, bundle of his, SA node, Purkinje fibers. B. SA node, Purkinje fibers, AV node, bundle of his. C. SA node, AV node, bundle of his, Purkinje fibers. D. Purkinje fibers, AV node, SA node, bundle of his. The right answer is C. SA node, AV node, bundle of his, and Purkinje fibers. This is the right way for cardiac conduction. Question 8. The iota pierces the diaphragm at the level of dash, which means at which point the iota crosses the diaphragm. Options: T8, which means thoracic vertebra 8, thoracic vertebra 12, thoracic vertebra 10, and cervical vertebra 6. The right answer is thoracic vertebra 12. So it is at this level the diaphragm crosses the, or the iota crosses the diaphragm. It is at this point the thoracic aorta is transformed into the abdominal aorta. Question 9. A nurse is assessing an electrocardiogram rhythm strip. The P waves and QRX complexes are regular. The PR interval is 0.16 second and the QRS complexes measure 0.06 second. The overall heart rate is 64 beats per minute. The nurse assesses the cardiac rhythm as dash. A. Normal sinus rhythm. B. Sinus bradycardia. C. Sick sinus syndrome. D. First degree heart block. The right answer, normal sinus rhythm. So if you see this electrocardiogram strip, they have given description that the PR interval is 0.16 second. So the normal PR interval is 0.12 to 0.20. So it comes in normal. And if you see QRX complex, they have given it as 0.06 seconds. The normal QRS complex duration is 0.4 to 0.10 second. So that is also normal. Again, if the rhythm starts from SA node, from the normal place, the heart rate normally it used to be 60 to 100. So again here the overall heart rate is 64. So everything is normal here. So it is a normal sinus rhythm. The other options given here are sinus bradycardia. So sinus bradycardia, the heart rate will be initiated from SA node. Question 10. The nurse is watching the cardiac monitor and notices that the rhythm suddenly changes. There are no P waves. The QRX complexes are wide and the ventricular rate is regular but above 100. The nurse determines that the client is experiencing dash. A. Premature ventricular contraction. B. Ventricular tachycardia. C. Ventricular fibrillation. D. Sinus tachycardia. The right answer is B. Ventricular tachycardia. So how it is? The ventricular tachycardia is characterized by absence of P waves. So characteristic of that is, number one is absence of P waves, and there will be wide QRX complex. So the QRS complex duration will be greater than 0.14 second, and the heart rate will be between 100 to 250 beats per minute. And again, it will be regular. So here everything is suitable for ventricular tachycardia, and in that ventricular tachycardia there are two types, sustained and non-sustained. If tachycardia is continuing for more than 30 seconds, it is sustained ventricular tachycardia, SVT. If it is less than 30 seconds continuously, it is called non-sustained ventricular tachycardia, NSVT. The other options given here are premature ventricular contraction. So in premature ventricular contraction, what will happen is, question 11, which of the following symptoms is most likely origin of pain the client describes as knife-like chest pain that increases in intensity with inspiration? So in the question you have to note important point, the characteristic of pain is it is knife-like and the intensity increases, the pain increases with inspiration. So what kind of pain it is? Option A, cardiac. Option B, gastrointestinal. Option C, musculoskeletal. Option D, pulmonary. So the right answer is option D, pulmonary. So pulmonary pain usually will be described by these symptoms. So the pain will be sudden and sharp. So that will be like a knife-like pain, and the pain will be increasing with inspiration. So that is pulmonary pain. So cardiac pain, how it will be? Usually pain because of myocardial infarction or any other angina will be a dull pain. So cardiac pain will mostly be dull pain, chest tightness, pressure in the chest, uncomfortable feeling, nausea. All these things will be there in cardiac pain. And the most important thing is cardiac pain will be diffuse. It will be spreading. You cannot locate the pain or pinpoint a particular location. So you can, that is the most important thing which you have to see. In 12, which of the following blood test is most indicative of cardiac damage? So, which cardiac biomarker is most indicative of cardiac damage? Number 1, lactate dehydrogenase. B, complete blood count. C, troponin. D, creatine kinase. The right answer is option C, troponin I. So, why it is? Troponin I is an enzyme that will be present in the blood circulation only if there is a cardiac muscle damage. So troponin I levels rise rapidly and are detectable within 1 hour of myocardial injury. So any damage to the heart muscle, myocardium, that can happen because of an infarction or etc., there will be a rapid rise in the troponin levels. So it will immediately start to flow in the circulating blood. Number 2, option A is lactate dehydrogenase. So lactate dehydrogenase is present in almost all the body tissues. So any damage or any infection can cause lactate dehydrogenase to be present in the blood. So causes can. Question 13. What is the primary reason for administering morphine to a client with myocardial infarction, MI? Option A, to sedate the client. B, to decrease the chest pain. C, to decrease client's anxiety. D, to decrease oxygen demand on the client. Right answer, option D, to decrease oxygen demand to the client's heart. So if you see, the action of morphine is mainly, it is an opioid drug to minimize pain. But here in myocardial infarction, it is not given primarily to treat pain. It is given to decrease oxygen demand. How? So morphine has an action. It has hemodynamic function of as a venodilator also. It can vasodilate. It can, it's especially a venodilator. It can also mediate histamine processes. So what happens here is when you give morphine, the venous return to the heart is reduced. Question 14. After an anterior wall myocardial infarction, which of the following symptoms is indicated by auscultation of crackles in the lungs? So the question is, a person has anterior wall myocardial infarction and during assessment there is crackles in the lungs. So which problem has happened is the question. Option A, left-sided heart failure. Option B, pulmonic valve malfunction. Option C, right-sided heart failure. Option D, tricuspid valve malfunction. The right answer, option A, left-sided heart failure. So what happens during this myocardial infarction in anterior wall? The most affected area will be the left ventricle, and left ventricle is the most responsible part for cardiac output. So what will happen? More blood will be stagnated in the left ventricle. So if blood is stagnated in the left ventricle, blood from the lungs also will not be able to enter into the left ventricle. So what will happen? There will be accumulation of fluid inside the alveolar spaces and the interstitial spaces of the lungs. So this fluids inside the lungs will cause crackles in the lungs. So if there is crackles in the lungs after myocardial infarction, it means it has resulted in left-sided heart failure. Question number 15. Which of the following arteries primarily feeds the anterior wall of the heart? Option A, circumflex. Option B, internal mammary artery. Option C, left anterior descending artery. Option D, right coronary artery. So the right answer is left anterior descending artery. So LAD. So the left anterior descending artery is the primary source of blood flow for anterior wall of heart. Left anterior descending artery supplies the anterior 2/3 of the septum. The left anterior descending artery is one of the two major branches of the circumflex of the LMCA, with other being the left circumflex coronary arteries. Combined, these two supply to the left atrium and left ventricle. So with this, we come to the end of Jipmer Aiims Norcet series part 2, cardiovascular system. If you have any queries, you can post it in the comment box. If you want any specific topic also, you can post it in the comment box. We will try to post videos regarding that. Thank you. Please do like, comment, subscribe, and share our channel so that my effort reaches you on time all the time.